Then the patents expired, and DARPA decided that they agreed with some of the papers that I had written, particularly together with Dr. Annie DeGroot of Epivax, advocating that this technology could enable rapid response, which is a major problem in the biodefense space with vaccines. The intention was more for special forces and small groups, so small custom made vaccines for emerging infectious disease or engineered pathogens. And DARPA dumped money, particularly into Moderna, DARPA being basically an arm of the CIA. And even now in the present, the new manufacturing facility that's just been stood up in Canada is funded by InQtel, which is the investment fund arm of the CIA. So our intelligence community is all over this and pushing this forward, and they've been doing so for about the last 10 years. And the logic is that there is a huge unmet need for the ability to respond rapidly to an infectious disease threat. And I think that there was a number of failures at Moderna, as you correctly point out. They never really settled on the vaccine indication. This is kind of Johnny come lately to this. And also at BioNTech, there was an effort to move this forward, and at CureVac. CureVac actually got investment funds from Elon Musk. The others got different sources of capital. BioNTech is funded in part by the German government. And then we had the run up to this event. And let's not get down the rabbit hole of Event 201 and the pre-planning and the patents that David Martin has pointed out, and the fact that Bill Gates made major investments in these companies in a remarkably prescient way. But it all happened. The data, the facts are the facts. We just don't know what was inside of their heads. So I'm not going to go there, and I suggest we don't either. But it happened, and there was this governmental thrust in trying to advance this technology. And then, for some reason, the strange decision that all of the regulatory norms that have existed for vaccines and gene therapy, because this is both, would be basically thrown out the door. And all of this would be expedited in a mad rush to try to get something, while meantime preventing any other alternatives, because it would compromise the emergency use authorization pathway. I think that all of that is very well documented, what I've just said, and I don't think that the LA Times or the New York Times or the Washington Post can criticize any of those